Last week, we started discussing recommendations from a recent review article assessing exercise routines after bariatric surgery. We went through the first 3 recommendations and we are ready to move on with recommendation number 4. The authors state that patients who undergo bariatric surgery should minimize prolonged sitting and adopt lifestyle that decrease sedentary time due to sedentarism being associated with 1, decreased weight loss after bariatric surgery, and 2, weight regain after bariatric surgery. This is a pretty common sense recommendation. It is important for people to get into a routine that involves movement in different forms. We'll get a little bit more in detail about what kind of exercises one can do. Recommendation number 5 states that patients should progress to 150 to 300 minutes of moderate intensity cardiovascular exercise per week in order to promote weight loss, preserve fat-free mass, improve the VO2 max, and overall improve the quality of life. There is a lot of talk nowadays about VO2 max. This represents our body's ability to extract oxygen during high-intensity exercise and is a measure of cardiovascular fitness. Some listeners may be familiar with Dr. Peter Attia's work, who states that people who have a VO2 max in the bottom 25 percentile versus people who have a high VO2 max in the top 2 percentile. So the ones with the lower VO2 max have a 400 increased chance of all-causes mortality when you compare them with the top 2 percentile. So VO2 max is the one factor we can actually control and is strongly associated with increased longevity. So we should all aim to be somewhere in the top tier for our gender and age group. Recommendation number 6 states that walking should not be the only form of cardiovascular exercise and that patients should add other low-impact activities such as dancing, elliptical, or resistance bands in order to promote their cardiovascular fitness. Again, this is pretty common sense. Walking is important. We will talk more about it and the type of walking that I particularly encourage our patients to do. It's a little faster pace, what we call zone 2 cardio. But in order to improve your overall fitness and abilities to do more, it's good to use some variety of techniques, and those are really good examples of what a bariatric patient can do after surgery. Well, this is all for today. Also planning to put together a sort of exercise plan to help people start at least and be successful after bariatric surgery throughout their bariatric journey.